15 times a day of stuff that I see. We're big sports fans, and I'll text him and go to him about his favorite team or his favorite player, and about how players in my generation were better. Michael Jordan's still the greatest basketball player ever lived. I don't care what he says, and I don't want to hear anything about LeBron James. It's just a fact, right? So I'm going to wear him out about that, and I get great pleasure out of doing that. And I love looking down and seeing his retorts. And when I read that, I thought, man, what if I didn't get to do that anymore? What if I didn't, look down in the middle of my day and see a text from Heath there about, something that we've talked about or something funny that I've seen. Guys, that's what we're talking about. We're talking about losing a generation of kids, which is basically what's happened in rural Appalachia, where I'm from, and now it's spreading across the country. And I'm tired of watching that, because when you start to look at some of the things that we can do from a public health standpoint, namely wide access to medication-assisted treatment, we're talking about saving lives. And everybody's path to recovery is different. So I'm assuming, since I've got this crowd in here, and I know what your feels are, I'm assuming some of you are in recovery yourself. And I think you'll agree with what I'm getting ready to tell you. When you look into recovery field, there's a whole group of people out there that got clean and sober through the 12-step programs. And I'm a big advocate. That's how it happened for me. But those same people would turn around and look down their nose at somebody who's using medication, because they say, oh, you're not really in recovery. Okay, you're not, and I'm sitting here thinking, you've got to be kidding me. You've got to be kidding me. Guys, there are a million different paths to recovery. We have to help the patient find the one that's right for them. That's pure and simple. I don't know about you all, but I have yet to figure out how to treat a dead person. I can't think of any way to do it. If I can keep them alive, and medication has a 70% mortality benefit. What does that mean? What's that mean? We hear mortality benefit all the time. What's that mean? That means that 70% of the people who would have died don't. So if I have something that I can give you and keep 70% of you alive who would have otherwise dead, would you all be in favor of it? My guess is yes. There's not another drug out there that has a 70% mortality benefit in any field, in any part of medicine. Not anti-blood pressure medications, not heart medications, not even insulin for diabetes. Right? And so that's what I'm talking about. Access to medication to hold people in the recovery process until we can get behavioral change. That's it. Because people get better with behavioral change. I'm better today. Now, I'm 1,000 miles away from my home, I guess. I'm not even really sure actually where I am. I had to look at a map last night. I'm really close to Mexico. Now, I like that. So I'm down here by myself. And I'm just guessing that there are drugs in McAllen, Texas. I'm pretty sure there are, okay? I'm guessing. There's nobody here keeping an eye on me. The guy who was going to speak later today is sick. He can't come. Trina's not here yet. Who's going to speak to you guys later. I'm by myself. I can go do what I want to. Nobody's going to know. I went out to eat at a really good restaurant last night. I came back. I watched a little bit of TV. I read. I went to bed. And I came here this morning. Right? That's behavioral change. Because back in the day, oh, it would have been on. Right, I've got 24, 48 hours away from my family. Here we go. Right, and I got there through behavioral change. I didn't get there because of a pill or anything. I got there because I had great people helping me look at myself, look at my behaviors, and teach me how to make better decisions. So that's what I want to talk about today, is how these two things can work together. Because we're never going to have a pill that solves addiction. It's not going to happen. But what we do have is we do have medication that can hold people in the treatment process. Now, when I was driving here with the taxi cab driver, we were coming down from McAllen to here, and I looked over and I saw 3 big buildings that said Behavioral Health Solutions on them, and I'm assuming that that's what you do, right? So I'm assuming that in those buildings, that's what happens. People come in for counseling on a daily, a weekly, a monthly basis, or whatever. That's where you get true behavioral change. But guys, with opioids and heroin addiction, we're talking about a different ballgame. We're talking about something that one time will kill you. I'm always thankful for pain pills, because it would have taken alcohol another 35 years to kill me. And I'm not downgrading alcohol at all. Believe me, it had taken it 35 years to kill me. Pain pills brought me to my knees in 3 years. And the problem now is we have heroin that's laced with fentanyl, and you don't know it. And I'm going to show that to you a little later. And even the scarier thing is fentanyl that's pressed into pills that look just like what people are getting out of pharmacies. So you all hear on the radio or hear on the news all the time, we've got a problem with fentanyl in the United States, right? But it's not the fentanyl you're thinking of. It's not the lollipops. It's not the patches that you see on cancer patients. This is powder fentanyl that's pressed into pills that look just like the pain pills that your patients are taking. So they take it one time and they die, and they never know what they took. So we're going to get into that, and I want you to pay really close attention. How many of you have teenagers in here? Anybody have teenagers? You guys pay particular attention. I'm going to teach you today why they're stupid.
Okay? They're not really stupid. They make bad decisions, and I promise you it relates to substance abuse, even though they don't have a substance abuse problem. I'm going to read one more thing to you. I'm currently reading, again, Gabor Mate's In the Realm of Hungry Ghosts. If you haven't read it, I highly recommend it. It's pretty thick, but I promise you it'll get your attention. And I've already read it once. It's been out about 10 years, and I've started rereading it. And I ran across this last night, and I wanted to share it with you because this, to me, sums up addiction. There are in the Buddhist world, they have something called the mandala, and the mandala are basically the realms that we go through in our life. And there's 6 realms, and just to share one of them with you, one of the realms is hell. You know, the hell things that we go through in our life. And so the realm that Gabor writes about is called the hungry ghost realm. And he said, and each of these realms are depicted by some kind of character, you know, some kind of monster or some kind of deity. And he says, the inhabitants of the hungry ghost realm are depicted as creatures with scrawny necks, small mouths, emaciated limbs, large, bloated, empty bellies. This is the domain of addiction, where we constantly seek something outside of ourselves to curb an insatiable yearning for relief or fulfillment. The aching emptiness is perpetual because the substances, objects, or pursuits we hope will soothe it are not what we really need. We don't know what we need. And so long as we stay in the hungry ghost mode, we will never know. We haunt our lives without ever being fully present. And I thought about that, and that was my life. I pursued things my entire life. I became a doctor because I didn't want to be an auto mechanic. My entire family are auto mechanics, and I couldn't work with tools, and so I didn't want to do that. And nobody in my family had ever went to college, and so I came up. I was sexually abused when I was a young boy at 5 and 6 years old by an uncle. I had physical abuse at the hands of my mom until I got big enough to where she couldn't beat me anymore, and I started taking her weapons away from her. And that's how I grew up. And nobody, like I said, nobody in my family had ever been to college, so I wanted to try to earn my worth. So I went and got a college degree at the University of Tennessee. And after that, I decided I'd go to med school. Keep thinking that there's something out there that if I put it inside of me, I'll finally be fulfilled and I'll finally have my worth. And what I learned is that that's impossible. It's never going to happen. And I went as far as you could go. I tried everything in the world and nothing worked. And then finally, when I was in my last year of residency, I discovered pain pills on my way home from work one day. Guys, I didn't grow up doing this stuff. Didn't use drugs a lot. I did smoke pot in college, but hardly ever, not a lot. I wasn't somebody who was a substance abuser my whole life. I was in my 30s and I had kids the first time I ever put a pill in my mouth. And I did it on the way home from work one day. I was in my last year of residency. So we got 4 years of college, 4 years of med school, 3 years of residency. So I'm in the 7th year post-college. And I was driving home from work one day and I flipped open the glove compartment of my truck sitting at a red light. And I had some old Norcos in there, hydrocodone. And I thought, my patients take these things all the time. I got them from a dentist office. I didn't use them. I just slung them in my glove box. And I picked that pill up. I broke it in half. I threw it in my mouth. That's 2.5 milligrams of hydrocodone. By the time I got home, I felt like I'd found that thing inside of me that filled me up. I felt full. I wasn't anxious. I wasn't depressed. Suddenly my wife was treating me a whole lot better than I thought she did. My kids were better behaved. Right? The world was better. And within 3 years, I was using 500 milligrams of oxycodone and praying to God every night when I went to sleep that I'd wake up the next morning. And so when I read that passage, I relate to that because I lived that life. And I'm going to try to tie all that together for you today. I normally don't do anything from books, but I decided last night that I wanted to share both of these with you because I promise you that you're worth your time.
Who wrote The Hungry Ghost?
His name is Gabor Mate.
Thank you.
M-A-T-E. And you guys can stop me anytime. I've got till 10:30, I think. Is that right? I got somebody down here with these signs that are already ready to get on me. But I want to leave time for questions. And during the course of this, please feel free to stop. I don't have a planned agenda other than the slides to keep me on track. This is my disclaimer slide, and I'll explain the 70 times 7 here in a little bit. This is my disclaimer slide. I've been an expert witness for all of those groups, and they said in federal drug cases against doctors for prescribing pain pills, that's a little bit inaccurate. They were improperly prescribing prescriptions. So the doctors that I see are selling prescriptions, pill mills, and I know you all have them in Texas, Florida, Tennessee, they're basically everywhere. But they're writing pain medication without a diagnosis, basically to people with addiction, and they're charging them cash for them. The other thing that I prosecuted doctors for is trading sex for prescriptions, holding prescriptions for pain pills over young women's heads for sex. And I promise you it happens a lot. And so I've done that for the last 12 years. I'm a big proponent of drug courts. We've got to stop locking people up with addiction. If it worked, I'm fine with it. It doesn't work. I don't know how much money that the Department of Corrections drains out of the state budget in Texas, but I would pretty much bet outside of schools, it's probably the biggest line item on your governor's budget. And so we have to stop locking people up with addictive disease. 75% of all graduates of drug courts never get rearrested. 75%. If you look at the recidivism rate of about 80% for somebody who doesn't get treatment, then to me it becomes pretty obvious that we need treatment and not further incarceration. About 8 years ago, I founded a clinic in my hometown of Johnson City, which is at the very tip of Tennessee, right before you go into Virginia. And I founded a clinic to treat IV drug-addicted pregnant women. Now, I'm going to tell you a little bit about that. We have a lot of, our state, Tennessee is the worst state in the United States for babies being born drug dependent. Babies aren't born addicted, they're born dependent, and I'll teach you the difference here a little bit. So, I see these pregnant women around, and people would say awful things about them. Right? They were using drugs, they were struggling, and they would say, we actually passed a law in Tennessee that if you were drug addicted and pregnant, we're going to take your baby and put you in jail. That actually sounds like a law you guys would pass here in Texas. but we passed it in Tennessee, and all that did was drive women underground. Okay? And so I started asking questions. I said, well, these people who were saying these terrible things about these women, I said, what kind of treatment program do you have for them? What do you all do in your treatment program? They said, nothing, we don't take them. All right. So if you don't take them, I would appreciate you closing your mouth. Right? If you're not offering any kind of treatment to them, it would be very kind of you to not criticize them for what they're doing. So I opened a clinic where I treat IV drug-dependent pregnant women. I've done it now for, I guess, almost 8 years. I've treated over 300 women who've given birth to babies, some of them born dependent, others not born dependent. And I've had a lot of successes. I can stand up here with my phone and flip you picture after picture that I've got from moms and grandmoms across this country thanking me for helping their child while they were drug-dependent and pregnant. It's the most fun I've ever had in pregnancy, and I opened a nonprofit clinic in Johnson City that continues to do that to this day. I have 2 kids, Heath and Haley. Heath is 25 and Haley is 21, and she's married. He will never get married. I have almost no prospects of ever being a granddad. And I've been married to my wife, Karen, for 28 years, and I don't have any financial disclosures to make. No pharmaceutical company pays me or anything like that. All right, so I love this painting. When I was growing up in East Tennessee, if you liked the painting of the arts, if you liked, if you wanted to play in the band or you liked the theater, that would have been a good way for you to get your butt kicked in my school, right? You need to play football, basketball, baseball, anything outside of that's unacceptable. So I grew up like that, and it wasn't until my adult life that I became appreciative of the arts. And so this past summer, I got to go to Europe. I got to go to Paris, and I went to the Louvre. And still one of the most awesome days of my life. And I saw this painting. This painting is by Leonardo da Vinci, Virgin on the Rocks. And I don't know how you could really do that with just a paintbrush and canvas. But the reason I show you that is Da Vinci is one of the 3 geniuses in the history of man. I think it's Newton, Einstein, and Da Vinci. Da Vinci actually figured out that an airplane could fly, how it would fly, 400 years before the Wright brothers in North Carolina. So the guy was an absolute genius. So if he's a genius, we need to listen to him. He said, we have to be fearless about changing our mind based on new information. So my bet is that those of you in the room, before you first started in the substance abuse field, before you had started having contact with people with addictive disease, you looked at addiction as a moral failure. All right? These folks have some kind of something within them where they're just not morally where they need to be. They're making wrong choices. They're fundamentally a bad person. So if you continue to believe that to this day, I'd ask for the next hour that you just sit that off to the side. You can pick it back up here in a little bit, but I'd like for you to hear me out today. All right? And try to open your mind a little bit to maybe that's not as straightforward as that. Because I can tell you for sure, I woke up every morning for 2 years wanting to quit so bad I couldn't see straight. I tried everything in the world that I knew, and I couldn't quit. And I was going to church and doing all the things I needed to do the whole time. It didn't help me one bit. I was still using. I used in church. Okay? And I can tell you that most of your patients don't want to wake up every morning and stick a needle in their arm all day long. They don't have a choice anymore. And I'm going to try to describe to you how that happens. So I'll ask you just to put those things to the side for an hour, and you can pick it back up at the end of my talk if you like. So I want you to name me another disease where people feel like they do about addiction. Is there any docs in the room? Any doctors besides me? What kind of doctor are you? Family medicine. Okay, I'm going to exclude you. You got to get out to the side. All right. So if the gentleman right here at the front drops dead, drops dead. Hopefully you don't drop dead. If he drops down on the ground right now and clutches his chest, who you all going to want to help him? You don't count.
A medical doctor.
Okay, and who's the medical doctor in the room? It's me. I've handled hundreds of heart attacks and strokes and all that stuff acutely. You're probably going to want me to handle it. And more than likely, you're not going to tell me how to do it unless you're a nurse, and then you for sure will tell me how to do it. But that's okay. I'm good with that. Right? So nobody in the room is going to jump up. You're going to assume that my medical training and my experience is this gentleman's best shot of getting through what he's going through, more than likely. Now, let's change the scenario. What if this gentleman has addiction? Everybody in the room knows what to do. Right? Everybody in the room has a feeling. You need to do this. You need to do that. You need to do this. And the only way that can be is you view addiction as a moral failure and not the true disease that it is. That's the only way. I understand it. But it's not going to get us anywhere as long as we're imposing our moral thoughts on the disease process. So I was out in California a few years ago, and there was an article in the LA Times on prescription drug abuse, and I thought that was an East Tennessee hillbilly thing, and I didn't know they had it in California. So I read the article. And at the end, I made the mistake of reading what the bloggers say at the end of the article. I don't do that anymore, but I was into it back then. And it blew my mind that people were saying this about this problem. The first one said, how about treatment that works instead of some ridiculous 12-step NAAA cult higher power nonsense that has a 100% failure rate? Well, that's actually not true. First of all, AA, NA, 12-step recovery, those aren't treatment. Okay, it's recovery support services. It's community. It's not treatment. Dr. Bob and Bill W., the two founders of Alcoholics Anonymous, never intended for AA to be treatment. Yet 95% of the treatment programs in the United States use that as the basis of their treatment. It's not treatment. Treatment is addressing the underlying behavioral health issues that our patients are suffering from. It's addressing that I'm going to talk about the ACEs in a minute. Anybody know what ACEs is, right? Adverse Childhood Experiences Study. Anybody know? It's the most important study ever done in the history of medicine. And it looks at trauma's effect earlier in our lives and what the outcomes of that trauma is years later with regards to substance abuse, mental health, and even things like diabetes and heart disease. Guys, if we're not addressing people's trauma and addiction, we're missing the boat. They're not going to get better. It's as simple as that. Because here's the truth. We use drugs to change the way we feel. For years and years, I battled. Next thing on the wall was going to solve the problem inside of me. Guys, the problem inside of me was the fact that I was sexually abused when I was a kid by my favorite uncle, and I was beaten by the woman that was supposed to take care of me when I was a kid. I never dealt with that until I was in my mid-40s. And that was even a while after getting into recovery. Okay, so we have to understand that this is not treatment, it is support. Okay? But it does work, right? It does work. I'm here today. I'm nearly 15 years clean and sober. And there's millions of people like me. The next one says pain medicine specialists are hard to come by. They're not covered by my insurance. And my physicians will not treat my pain properly and threaten me with no medication. Now, I'm going to let you in on a secret. And if I'm wrong, Doc, you tell me. All right, you stop me at any point when I mess up. How much training did we get in medical school and residency on the proper prescribing of controlled substances for pain? How many hours did you get? Very little. So you went to med school somewhere better than me because I got none. Okay, 0. So I got 0 hours on the proper prescribing of pain medication for acute and chronic pain. Okay? Now, I'm a physician. We have 4 years of med school, 3 years of residence. You'd think you could have worked it in there somewhere, right? And the truth is you had almost no more than I had. How much training did you get on addiction as a disease and the recognition of addiction and proper referral to treatment by level of care? How much training did you get for that? Yeah, very little again. Again, your school was better than mine. I got none. So our doctors out there who are writing prescriptions for pain medication have no training on the medication that they're writing. Does that shock you? It shocked the hell out of me, right? Do you know how they decide what to write? You know, if you have a surgery, what medicine, what dose, for how long? You know how they decide that? Because they don't have any training. You know how they decide it? It's called the SWAG method. Anybody familiar with the SWAG method? Scientific wild-ass guess. Okay, that's what it is. That's the SWAG method. You learned from the guy who was your mentor, and he learned from the guy where I don't know where ground zero is out there. It's somewhere in the past. Do you know how many hours veterinarians have in their formal curriculum on the treatment of pain in animals? 75 hours. Guys, I'm letting you in on a little secret. It's still that way to this day. that people are paying lip service to this. What I'm talking about today is the #1 health problem in the United States is addiction. Okay, I promise you it is. And if you throw in cigarettes, we're off the charts. Right? Cigarettes it kills more people than anything I can think of. It's the #1 preventable cause of death in the world is cigarettes. Okay, yet we get no training in our medical school and residency on this. It's absolutely unbelievable. This one said that, so this is a doc here who's looking at a patient. He's doing one of two things. One, he's scared people are watching what he's writing, so he's not treating pain at all, which I can tell you is just as bad as over-treating it. Or this is somebody who's doctor shopping, going from doctor to doctor trying to get pain medication. Now, if you're the doctor and you have the training that I just told you, what kind of chance you think you have of picking this patient out? None. You don't have a chance at all. That's why prescription monitoring databases are important. We all have one in Texas now. So before a doc writes a prescription, it goes to the database, looks and sees, is this patient getting this medicine for any other doctor around? So let me tell you how doctors utilize that. Whenever they have a patient on there who's going to multiple doctors, getting multiple prescriptions, multiple pharmacies, that's called doctor shopping. And when docs see that on the report, how do they respond to the patient? What do you think they do? What do they do? They kick them out, right? They kick them out. Well, that's not going to solve anything. You just took somebody with active addiction and kicked them out. You just increased the market for street heroin and street pills, I promise you. We have to stop utilizing the prescription monitoring database as a gotcha. It's not a gotcha. It's an opportunity to step in and help you. Right? You have a problem. And the residents hate it when I do this. Oh man, they hate it when I see this, because I'm going to go in, I'm going to pull up a chair, I'm going to look my patient in the eye and say, hey, here's what I see. And here's where I think you are. How can I help you? And sometimes I get told to do stuff to myself that ain't legal in the South. Okay, I promise you that. But a lot of times I get relief. Patient looks at me and goes, yeah, doc, I got a problem. A few years ago, we had our university president's wife in the hospital. And I'm on my rounds in the morning, and I'm new to the service, and she's been in there for like a week, and they've run about 1 million tests on her, and I'm sitting there listening to the story, and I was like, oh man, I knew it. None of those tests were going to find out what problem she had, because she had addiction, and everybody was scared to say anything to her because she was the president of our university's wife. And I went in, I pulled up a chair, I sat down right in front of her, I looked her in the eye, and I told her what I saw. She wound up going to Hazleton. She got into recovery, has been in recovery a number of years now. Okay, so people do get better. The gentleman who was up before me says every once in a while you'll get people who thank you. Guys, it happens to me all the time. If we offer people the opportunity of recovery, a lot of them will take it if we provide the right path for them, and that path is the one that works best for them. So that's already now. This last one kind of hurt my feelings a little bit. Don't get mad at me. This is a quote. Okay. This person said 99% of addicts are personality disordered. They're mentally retarded. Now, I didn't write the MR, so that's not me. Whoever wrote that, they can deal with that. Right? But this is not true. It's not true. People with addiction in general, their IQ is actually a little higher than the average person's. Okay? I'm from the 1980s, and music in the 80s and 90s is far superior to this crap we have today. Okay? I promise you it is, because number one, we had Prince, and number two, we had Michael Jackson. All right, so we had Prince and Michael Jackson. Both of my musical heroes died of addiction. And my musical hero, even further than that, my mom was a child of the 1950s and the biggest Elvis fan that ever lived. Elvis died of prescription drug abuse. So 3 of the biggest names in the history of music all died of addiction. Would you say that those 3 guys were not talented and not smart? Absolutely not. Prince was a genius. I'm not sure about Michael. The jury's out on that one. I have to look a little deeper, but I can assure you Prince was a genius. All right, so who wrote this? We don't know the person's name, but we know who wrote it. Somebody who has somebody in their family who's struggling with addiction. Because this is what we do when we don't understand something or we get frustrated. We lash out. It's much easier for me to yell at you and blame it on you than it is to help you walk through a difficult process. So we know who wrote that. And the truth is that is a false statement. That's coming from someone that's wounded. Sorry, I don't have a clicker, guys. So this is my hometown. This is Johnson City. I didn't sneak and take this picture. It was on the front page of our newspaper, so I didn't do anything underhanded. We had a clinic that wanted to come to town, and this clinic is going to take medical students, medical residents, pharmacy students, pharmacy residents, social work students, nursing, all of the different health fields, and we're going to have them rotate through this clinic as we treat people with addictive disease. All right, now I already told you there's no training now. We're going to provide a training spot for this. And in the process of that, we're going to use methadone and buprenorphine as two of the things that we help people in recovery with, although it's a small part of the overall process that people are going to go through with addictive disease. Now, this is in Northeast Tennessee. Remember I told you, right? It is the highest concentration of drug-dependent babies in the United States is that little area right there. So we have a huge problem. We have nowhere for people to get help. So we're going to open a clinic. So the good people of Gray, Tennessee, which is my hometown, come out and guess what? They don't want the clinic in their backyard, right? We don't want this here. And I've been before multiple city commissions, city councils, state government, even national government. And every time I'm advocating for places to give people help with addiction, some guy or gal up on the podium will raise their hand and say, Dr. Loyd, we're worried about bringing drug addicts into Bristol, Tennessee. And I always laugh. I said, hell, I saw 3 of them sitting outside on the way in. They're everywhere. You're not bringing people in anywhere, guys. They're in your community. In a room this size right now that I'm looking at, 3 of you have this problem right now, today. Okay, it's everywhere. I promise you it's in your schools. And so this guy here, he's got a sign. He says, not among our schools. Well, I got news for you, buddy. I know the school. I know the kids who go there. It's already in your school. We're talking about reaching out and helping these folks so that they don't die. Do y'all know what Skittles parties are? Do y'all have Skittles party in Texas? You ever heard of it? So when I was in college at the University of Tennessee, we used to have something called Harry Buffalo parties. So everybody would bring a pint of white liquor. We'd have this great big trash can. Everybody would pour their pint of white liquor in this trash can. We'd dump some Kool-Aid on top of it and have at it. Right? Those were pretty nasty. Well, now they don't do that. They have something called Skittles parties. So they will go to their parents' or grandparents' medicine cabinets, pull out whatever pain pill or benzo they find, dump it in a bowl, mix it up, and pass it around at parties. Skittles parties. Right? And I see kids die as a result because they've never been exposed to opioids. They take a handful of opioids and Xanax and don't realize those two together will kill you. Most of the time, don't dump alcohol on top of it. It's a huge problem. And this is not starting in high school. This is in elementary and middle school. And in high school, kids are already exposed. We have to start our intervention efforts earlier, guys, way earlier. And I would advocate elementary school at the very latest. The thing that really makes me angry about this picture is right here. 3 little girls look like they're about age 10 to me, although the older I get worse with that. Look like they're about age 10. Now, I know that one of those 3 little girls will have this problem in her life by the numbers. And I want to ask you, how likely do you think they are to step out and ask for help remembering this? Guys, we got to stop doing this. We got to stop poisoning our kids with our own biases. And until we do, I think we're going to keep headed down the same road, because the biggest problem that we have in the current crisis with addiction we face in the United States right now is not access to treatment, although we need more of it. It's not lack of prevention, although we need more of it. It's the stigma associated with addiction. There are people in this room right now that have a son or daughter that's struggling with this, and you work in this field, and you're scared to turn around to the person at your table next to you and tell them about it because you're ashamed. You look at it as a moral failure or failing on your part, and I promise you it's not. And we're not going to get anywhere, guys, as long as we keep doing things like that. I go to a nice church in East Tennessee. Nobody in my church is worried about where their next meal is coming from. We all look good on Sunday morning. We drive nice cars. And we will sit in my Sunday school class and we will pray that somebody sells a piece of property. I don't know if y'all's Sunday school classes work like that. At the start of the class, anybody got any prayer requests, right? And somebody raise their hand and say, I need to sell this piece of property. Now, personally, I think that's ridiculous, but whatever. We'll pray for it. I'm good with it. All right? God can decide. That same person will have a kid that's been struggling with drugs and alcohol, and they've had their picture in the paper twice in the last week, and they won't open their mouth about that. And everybody in the room knows it. And we have to get away from that. And we have to get rid of the shame associated with addiction, the stigma associated with it, open ourselves up, and bare ourselves to our fellow human beings so that we can get help. I've stood up here today. You all don't know me from Adam. I've never been to this part of the country in my life. And you already know a whole lot about me. You know about my hurts. You know about my shame. You know a little bit about my abuse history. And I'll guarantee you, there's a lot of you in the room that are connecting with me right now for that very reason. And we don't do that. We don't give ourselves an opportunity to connect with other people because we don't let them know what's going on inside of us. And that will keep us right where we are. I love using that picture. I don't want to shame anybody, but I do want to point it out. As a matter of fact, that clinic opened. It has done really well. It now treats over 200 patients. And despite what they thought, we haven't had a rash of people getting robbed. We haven't had a rash of increase in drug use. As a matter of fact, local police say the crime in the area has actually went down. because people aren't stealing to get their drugs anymore, and people are getting help. That will get us where we need to be. I always like to draw the parallel with the current opioid crisis with the AIDS epidemic in the 1980s. And I'm looking around the room right now, and I see some gray hair and I see some balding heads. And I'm a big fan of that because I teach in medical school, and my students are young, really young. And so when I start talking about AIDS in the 80s, they have no idea what I'm talking about. You guys will. And if you remember when HIV disease and AIDS first came on in the early 80s, how people treated it, right? It was unbelievably stigmatizing. I remember my first experience with, HIV disease or AIDS was Rock Hudson on the cover. It was either Time or Newsweek, and he was real thin and emaciated. And there's this virus that started out on the West Coast that's really, killing people with IV drug use and gay men. And so it's spreading across the country, and there's an incredible amount of stigma associated with it. And for those of you that remember the 80s and what I'm talking about, back then when you heard that somebody had HIV disease or AIDS, what was the first question people asked? Come on. Yeah, somebody said it. How'd you get it? That's an interesting question, isn't it? Why'd they ask that?
Because they think it's contagious.
Maybe contagious, I agree. There's a bigger reason than that, though. Because somehow if I'm not a homosexual male or an intravenous drug user, this doesn't apply to me, and they did that to bring it on themselves. As long as I stay away from it and don't touch it, I won't get it. That's the real reason. And I saw it time and time and time again. There was actually a period in the mid-80s where people were real skittish about letting their kids swim in swimming pools with other kids. You remember that? Right, and then some things started to change because, guys, we had AZT, which we still use for HIV disease and AIDS today. We had that early on. It got hung up in the FDA process for approving drugs. So you had a drug that was effective early on in HIV disease and AIDS. People were still dying of it and didn't have access to the drug, right? Because it was hung up in the process. And so you had some things that happened that changed HIV disease and AIDS because the big problem with it back then was stigma. Okay? And so you had some things change. You had this group called ACT UP. ACT UP marched on Washington. They had signs and posters. They said, hey, we're dying. Fast track our drugs. We don't deserve to die. You had this kid named Ryan White who got it from a blood transfusion. As a matter of fact, Ryan White's foundation still to this day provides highly active antiretroviral therapy to people with HIV disease and AIDS. And I think you could never underestimate the impact of Irvin Magic Johnson in the early 1980s or early 1990s. Magic was one of my heroes. And he gets on TV and he announces that he has the HIV virus. And I remember watching it and I was crying. And he said, but I'm going to live. And I remember thinking, you'll be dead in 5 years. I remember thinking that. Well, Magic now owns the Los Angeles Dodgers. They made the World Series last year, and he was on TV, and he don't look like he's missed many meals, all right? So the point is that as stigma melted away and medications became available, what happened to news reports of HIV disease and AIDS? What happened to death rates? They plummeted. Matter of fact, if you have HIV disease or AIDS in the United States right now, and you get treatment, you step into treatment, more than likely you're going to live a normal lifespan. When's the last time you opened the newspaper down here and saw an article on HIV disease or AIDS? I can save you some time. You ain't. You hadn't. The only way you'll see one is if there's an outbreak associated with IV drug use, which is what I'm talking about now. So I'm here to tell you today that I think that the opioid epidemic is this generation's HIV disease and AIDS, and I think there's a lot of parallels that you can draw. Number one, stigma is the biggest problem. Number two, we have life-saving drugs that people don't have enough access to, right? And number three is people can recover. They do get better. Guys, this is unbelievably treatable. We should have 80-90% of our people in recovery instead of substance abuse. I have no question about that if we make the resources available and get rid of stigma. So I love this picture. I finally get to what this picture is about. Anybody ever seen this picture? This picture is credited with changing the face of AIDS in the United States. 1990 Life magazine. The young man right here in the middle is David Kirby. David was born and raised in Central Ohio. He moved to the West Coast and acquired the HIV virus. He came home to Central Ohio to die. He died just a few hours after this picture was taken. And I love the look on his dad's face. Look at his dad's face. You think his dad cares how he got the disease? Looks like a dad that's losing his kid, right? Looks like all of us if we're losing our kid. And guys, I see this all the time now. The most affluent county in our state is Williamson County. It's just west of Nashville. I hardly know anybody who can afford to live there. All the country music stars live there, right? And do I have 10 minutes left?
No.
Okay.
No.
I was going to really panic. All the country music stars live there. And I've done multiple talks in Williamson County, and I've had moms come up to me after my talks and tell me about doing CPR on their own children in their own beds that they grew up in. And they lost them to heroin overdoses in the most affluent county in our state. Okay? And now there's a list of things that mommies should never have to do. And I'm going to advocate that at the top of that list is CPR on their own kid in their own bed. Their faces look like this. I love this picture. And I want to ask you what the picture is that changes the face of addiction in our country. When do we stop treating as a moral failure? When do we stop people slamming people in jail for it? When do we stop arresting mommies and taking their babies because they have addictive disease? I actually think the picture that changes is the drug-dependent baby. I think people still care about drug-dependent babies, and I think that the drug-dependent babies start with drug-dependent mommies. So I'm going to tell you a quick story about how I got interested in the pregnant woman. And I call them my pregnant women, and I've got to stop doing that. I am not the father, just so you all know. So if I slip up and do it, let me know. Hang on one second. My wife would be glad to know that. When I first started doing this, I worked at a little outpatient clinic on Saturday mornings. All I'd done is I'd taken an online class on the prescribing of buprenorphine. You got to get something called an X number in order to prescribe it through the DEA. And one of my first patients came in. It was November. Now I live in the mountains of East Tennessee. In November in the mountains of East Tennessee, it's cold. Right? We actually have snow in November. And this little girl came in and she had on a little spaghetti strap top and no coat. And she came in and she sat down. I flipped open her chart. I noticed that she's pregnant. And I look at her birthday. Her birthday is 1 week before my son. And my son was a senior in high school at the time. So I have this little 18-year-old girl sitting in front of me. And I look up at her on her shoulders because she just has this spaghetti strap top. And I see these little marks that are about that big in diameter and perfectly round. It turns out those are cigarette burns that relatives have abused her. And so I started getting into her history, and you'll see the reason I ask these questions a little bit later in my talk, but I get into the trauma history, and I ask her about sexual abuse. And guys, this patient is the one that changed everything for me. Because of the stuff I'm teaching you today, I didn't believe any of it. I thought addiction was a moral failure. If we could just give people drugs, at least they could stay there. And there really were moral deficits, and there wasn't much we could do to help them. That's really what I thought. And this patient changed all that for me. And I asked her about her abuse history, and it turns out that when she was 4 years old, her daddy started raping her. Now, at the time, my daughter Haley what was Haley back then? Haley was 8 or 9. Every morning of Haley's life, I went into her room because I go to work early. She's still asleep. I get over to her bed after I've tripped over all the crap at her floor, and I dig down in the covers until I find her little head. And I kiss her on the head every morning of her life and tell her, number one, she belongs, number two, she matters, and that I love her every single morning of her life. That bed is the safest place in the world for Haley. Because to get to Haley, you're going to have to go through me. And I'll die. All right? There's no way you're going to get her. Imagine that bed being your worst nightmare. Imagine that being where your perpetrator perpetrated his crimes against you. And I'm sitting there and I'm just struggling. And I'm struggling now because I can still see her face. And so as we go on, she tells me what happened. He started raping her when she was 4. Her mom's living in the house with him. He would come in at night after she went to sleep. And when she was 7, she asked for a Yorkie puppy for her birthday. Now, the reason, I thought this was pretty smart for a 7-year-old. Yorkie puppies bark at everything, right? So her thought process was the dog will sleep with me. When Dad comes in the room at night, the puppy will bark and keep Dad off of me. Pretty good, right? And it worked until she was 10, and Mom got arrested for what? Drug use. So Mom goes to jail, and Dad has sole custody of her. He raped her every night until she was 13 years old, and she ran away from home. Guys, I didn't know anything about ACEs. I didn't know anything about the stuff I'm getting ready to teach you. But I did know that that girl never had a chance. And that's the day it all changed for me. I don't throw rocks anymore. Guys, it's just a story of people's lives, and we have to meet them where they are. If we don't help that young lady address her underlying trauma, I don't see her ever getting any better. I see her switching from one drug to the next, or switching from one man to the next, trying to do exactly what Gabor Mate said, trying to find that thing that fills us up inside. Because that's the whole reason for treatment. I could probably pretty much just stop right there. Because that's really the gist of it, and that's what I'm advocating for today. Treated her all the way through her pregnancy. She did really well. She gave birth to a baby that was non-drug dependent. About 3 months after her baby was born, I got a phone call, and this is the phone call that I hate the worst. She said, Dr. Loyd, my old man just got out. What does that mean? It means it's something called a baby daddy. I had no idea, by the way, what a baby daddy. Y'all know what baby daddy is? I had no idea. But my kids taught me about this thing called Urban Dictionary. And so I got on my phone, I now know what a baby daddy is. So I'm getting more educated all the time. But the baby daddy had gotten out of jail. And I was scared. And I lost her, and I haven't seen her since. So sometimes there are heartbreaking outcomes. I'm not sure what happened, but I don't think it could be good. All right, first thing I got to do in teaching you about addictions, we got to separate out dependence from addiction. Now I'm finally getting into my talk. Aren't you glad it only took me 30 minutes to get there? So we got to separate out dependence from addiction. Okay? I can get anybody in this room dependent in 14 days. Matter of fact, the process is going to start at day 3. So, I'm sorry, your name? Sandra? So Sandra has knee surgery. Her doctor writes her 90 oxycodone to get over her knee surgery, which is not unheard of. So Sandra's taking this like she should because she had knee surgery. At day 3 of taking that pain medication, the dependence process has already started. You're taking it just like you're supposed to. You're not doing anything bad. You're not taking more of it, not anything. The dependence process starts at day 3. So what is dependence? Dependence means when I stop taking the medication, I go through what's called a predictable physiologic withdrawal syndrome. I'm going to translate that for you. I get dope sick. That is dependence. Just because Sandra gets dope sick, does that mean that she has addictive disease? Heck no, it means she's a human being. I can do it to Elvis, the Pope, Gandhi, it don't matter. All I got to do is give them at least 7 days worth of prescription pain medication. At day 3, that process starts. By day 7, it's pretty much entrenched. And by day 14, it's for sure going to happen. And when they stop taking the medication, they're going to get dope sick. Okay? Now, most people just go through the dope sickness. They get fine. Feels like a little touch of flu. Maybe got a little upset belly, a little night sweats. In a few days, it goes away. They go about their life. Right? That is dependence. Okay? Now, addiction, on the other hand, and I love this because I know some of you all work in this field, and particularly the behavioral health guys. So behavioral health guys get somebody come in, and I'm not knocking your folks at all, please. I'm not being mean, okay? This is just me. They ask you this great big long list of questions, try to figure out if you have addiction, right? They have this, all these different things. There's the mini Minnesota this and cage and all these things. I don't need any of that. I really don't. What I need to know is, do you have continued use despite consequences? If you have continued use despite consequences, guys, you have addiction. And I don't care if it's drugs, alcohol, the lottery, internet, porn, Fortnite, don't matter to me, right? If you have continued use despite consequences, you have addiction. I get guys that come into my treatment center all the time. I'm the medical director at a large treatment facility in Tennessee. It's huge. And I get people come in. The number one problem I see every day, alcohol, far and away. Nothing close. Pills, opioids, heroin, those are all lower on the list. And I get guys that come in to me, and they're coming in for an evaluation, and they say, I don't have an alcohol problem, all right? I said, and they always tell me about the things they don't do. I never drink before 5 o'clock. I only drink beer, not wine. I only drink wine, not beer. I never drink liquor. I never drink at work. I never drink 2 days in a row. I only drink on the weekend. I don't care about any of that crap. Okay, how's your life? Where's your wife? She left me. Why did she leave you? She doesn't like it when I drink. Okay. What about your kids? Hadn't seen them in 2 years. Why? They don't like the way I treat my wife and them when I drink. Does this guy have a drinking problem? What's the most important thing to almost everyone in this room? Your family. He continues to drink despite losing his wife and kids. I don't need a mini Minnesota whatever to tell me that. What I need to know is, does he have continued use despite consequences? If he does, I can write substance use disorder secondary to alcohol down. He has addiction. Okay? The person with dependence does not have that. Babies aren't born addicted. They're born dependent. Why? Because they're going through a predictable physiologic withdrawal syndrome in regard to a substance they were exposed to. Babies cannot have continued use despite consequences. They're babies. So we got to stop doing that. We got to stop calling babies born addicted. They're not addicted. They're dependent. Okay. Now, on my internal medicine board exams, 2 days, 820 questions for me to start practicing internal medicine. Out of all those questions, how many do you think I had on substance abuse? 1.
Wow.
Number one problem in the United States, substance abuse is the number one killer of people under 40 in the United States. I had one question on it, and it was this. Which of the following is most predictive of chronic alcoholism? Is it A, elevated liver enzymes, B, jaundice, or C, the second DUI? Which one of those is most predictive of chronic alcoholism? Use my definition. Continued use despite consequences. The second DUI. Ain't got anything to do with blood tests, guys. Has everything to do with getting that second DUI. So why is that? Well, the first DUI, you spent 48 hours in jail in every state in the United States, right? Texas included, right? The second thing is it cost you 10 grand for an attorney, right? It cost you $10,000 to get an attorney to get out of it. And the third thing is, and I don't know if y'all do that in Texas or not, but we do it in Tennessee, we take your picture, your mugshot, and we put it in a little newspaper called the busted paper, and we sell it at the mini mart. So we publicly shame it, right? So public shame. So those are heavy consequences, guys. The second DUI is not an accident. That's continued use despite consequences. When I'm evaluating patients, when I'm evaluating Sandra in front of me, I want to know, do you have continued use despite consequences? If you do, you have addiction. I can go on. Now, the hallmark of addiction is that word I have up there in red called cravings. Now, when Sandra comes into me, she's a little bit dope sick. I question her. She doesn't have a family history. She doesn't have a trauma past. She doesn't have a personal use of substance use. I'm thinking, okay, Sandra's probably just dependent. I can reassure her, tell her she's going to get through this in a few days. I treat her symptoms, and she goes about her life. Right? Sandra's not. She's not an addict. She doesn't have addictive disease. Right? Because she doesn't have that phenomena that's in red up there called cravings. And everybody in the room knows what I'm talking about. When I do talks right before lunch, it's even more pertinent. Everybody knows what cravings are. Cravings are the same cravings you have for food when you're hungry and water when you're thirsty. Right? And there are things in your environment that can increase your risk of cravings, right? So right now, which is at 10 o'clock in the morning, if we were a little closer to noon and you guys had skipped breakfast, right, and I'm up here at 5 minutes till noon and they wheel the food in back there and you start to smell it, how are your cravings then? Right? They're starting to get ratcheted up. Those are cues in your environment that's cueing you to perform an action to get a result that you want, i.e. pleasure. Guys, it's the same thing as drug use. Now, here's the deal with cravings. People's cravings for the substance that they're using are 10 times stronger than your cravings are for food when you're hungry and water when you're thirsty. You think about that. What will you eat at the end of your day if you hadn't eaten anything all day long when you get home? Anything. It's the only time rice cakes are good, right? You'll eat anything. You'll eat anything, right? Now think about somebody who's trying to quit heroin. Their cravings for that heroin are 10 times stronger than your cravings are for food. When people find out what I do, they always want to tell me how to do it. And I find out about the pregnant women. This is the spiel I always get. Say, Steve, these pregnant women, they just need to stop. They need to lay it down. They're hurting their babies. They're hurting others. They just need to quit. And I always look at them like, thank you. I mean, like I didn't damn think of that. That was the first thing I thought of. Right, really. I thought of that first. It doesn't work. So I don't give that smart aleck answer anymore. I say, well, I would like for you to stop eating. Fair enough, right? I mean, 10 times, it's going to be easier for you to stop eating than it is my patient. I'm not saying that my patient can't stop, but they need help with those underlying things that we just talked about. So the phenomenon of cravings, there's some things you need to know about cravings. Number one, they're lifelong. Have cravings the rest of your life when you truly have addictive disease. Nearly 15 years in recovery myself, guys, I still have cravings. Does that bother you? I was the drug czar for the state of Tennessee. I had cravings when I was the drug czar for the state of Tennessee. I didn't use because I've got this thing, this tool bag that I use when cravings happen. One of them are these little things on my wrist. People always think I'm trying to be a hipster, although I probably am. But when I have cravings and I don't have anything else around, I'll flip them and it'll take my mind out of that process. The other thing is I reach out to my friends in recovery and say, hey man, I'm struggling a little bit today. And they meet me where I am. I had to stop telling my wife I had cravings because she thinks I'm going to relapse and use it any minute. And that's okay. That's okay. So, number one, cravings are lifelong. Number two, cravings happen in as little as 33 milliseconds. How long is that? Anybody? Some smart aleck always tells me 33 1,000ths of a second. I get that. Right? It's the time it takes you to blink your eye. Nobody in the room is conscious that you're blinking your eye. How do you defend yourself against something you're not even conscious of? Guys, by the time the needle goes in the arm, the drink goes in the mouth, the pill goes up the nose, right? The craving has started way before that. That's just the end result. So what are you guys trying to do with your patient? You're trying to teach them how to stay out of situations that are going to lead that in the first place. That's why you're trying to do it, because cravings happen before you're even conscious of it. All right? So they're lifelong. They happen as little as 33 milliseconds. Now, when I start talking about medication here in a minute, this is the reason. Cravings are what drives relapse. Not being dope sick. People get through dope sick all the time. 6 months later, they're back using. How many patients you had in front of you say, what's the longest time you ever had clean? By the way, I hate using those terms. Clean, dirty, it's all crap. Okay? We don't talk about diabetes, somebody with high blood sugar, you're saying you're dirty. Right? So what happens when somebody relapses back into addictive behavior? Right? What happens? Is it because of withdrawals? No. It's because they got cued, cravings, environment, the craving overcome them, and they used. It's predictable. We know it's going to happen. What medication does is it quells cravings. It quells cravings and gives the frontal lobe of the brain time to wake up. And I'm going to show that to you in just a minute. I promise you this is going to make sense, but you kind of got to build it a little bit. All right? That's the value of medication. Keep cravings at bay until we can achieve behavioral change. If we do that for a large enough number of people, we will truly bend the curve on what we're doing. So everybody gets cravings. You get why they're important in addiction, and that's what drives substance use. How many times have people said, I got 6 months one time. I got 8 months one time. We see it all the time. What happened? Got around somebody came over, got put in this environment, didn't have any of the tools to deal with cravings, and they go back to using. It happened to me 10 times. I would get through being dope sick, and I think, God, I'm finally through this. And then 6 months later, I'm using again. Same thing. Until I understood the phenomenon of cravings, I didn't have a chance at recovery. All right. So I'm going to talk about addiction in terms of biopsychosocial model, only I hate that word. It's a psychobabble word. It makes me vomit a little bit in the back of my throat. I don't like psychobabble words, but I understand a slot machine. I get how a slot machine works. Right? When the 3 sevens come down on the pay line, that's when the money comes out the bottom. Okay? So I'm going to talk to you about the biopsychosocial model, only I'm going to use a slot machine. And when I'm evaluating patients, I use this slot machine. So the first 7 is the bio part, the biology. I need to know about your family history. Guys, 60% of addiction is genetic. Not 100%, 60%. So all I need to know is your family history. And I don't know how it is here in South Texas, but Northeast Tennessee, nobody will tell you what they're doing. What's the most alcohol you ever drank? 2 beers. Right? I don't care if their blood alcohol is 400. They drank 2. Of course, they were that tall. But they drank 2. Right? Okay? But ask them about their family members, you won't be able to shut them up, right? Granddaddy was an alcoholic, grandma was an alcoholic, my dad was a drug addict, they'll go on forever. When I have a positive family history, I know that the first 7's on the pay line, my patient is at risk. The psycho part, tell me about the environment that you were raised in your home. Were you a victim of physical, sexual, or emotional abuse? Guys, I'm not blaming mom and dad, I'm helping you see how people get like they are. Okay, are you a victim of physical, sexual, or emotional abuse? The literature says 75% of all people who are pregnant and dependent upon drugs are victims of physical or sexual abuse. I say that's crap. It's 99.9999. I have yet to find a young woman who is not. And this is where the ACEs study comes in, adverse childhood experiences. 10 questions, I can have their ACEs score. Now I know if I have that second 7 on the pay line. The social part, the third 7, is just the availability. Guys, we don't have any more addiction in the United States right now than we did after the Civil War. The prevalence is still the same. More of them because we've got a bigger population. The prevalence is still the same. All that changes is availability. In the 80s, it was crack cocaine and powder cocaine. Right? Now, because of prescribing practices of doctors and big pharma, pain pills are widely available. It ain't that we have an epidemic of opioid use. We've had opioid crises in the past. We had the 70s heroin epidemic. This one's just so much bigger because it became socially acceptable. It comes from a doctor. It's okay. And then what happened is that their tolerance got up so high they couldn't afford the pills anymore, and the doctor stopped writing them, and nobody gave them treatment, so they went to the street and got heroin. And now they're dying. And that's exactly how we got where we are. Guys, that's the biopsychosocial model. That's what I use in seeing my patients, and it's what I try to teach. Now, we're going to wheel through each one of those individually. Hopefully, am I boring you? Hope not. I always get scared. All right, so I'm looking this way. We peeled off all the outer layers. Here's my brain. Think about the brain. It weighs 3.5 pounds. In real life, it has the consistency of snot, okay, that you blow out your nose, right? If your kid has slime, the toy slime, that's what your brain feels like in real life. Now, there's 2 areas I want to concentrate on. One is here in the middle, right there, right? And it's called our limbic system, and I'm going to show a cutaway, show you exactly where it is. Our limbic system, it's the reward center in our brain. It is the part of our brain that's responsible for our will to live, and it's responsible for our species going forward in time. Okay, that's the limbic system. And I'm going to get away from the use, and we're going to change the names of it. I hate that. I don't know who named the parts of the brain, but obviously they were sadistic. We're going to talk about go. So that's our go system. Now, the other part of the brain I want to talk about is everything in front of that little crevice right there in the front. That's the frontal lobe of our brain, and we're going to use it as stop. So we got go and stop. So the frontal lobe of our brain gives us insight and judgment. Okay, that's what the frontal lobe does a bunch of other things, but those are the two we're going to concentrate on. And the reward system, the go system, limbic system, is our pleasure center. It's where we derive pleasure. Okay, when we do things that make us feel good, the reason that they feel good is because we have chemicals in our brain that are released in the reward center. Okay, it's also responsible for our will to live. And I want to ask you this: what would you do right now in order to live? What would you do to save your own life right now? Right? I tell you, you'll do anything. If we take this room off, and I don't know what's in them bags back there, but it's looking good because I hadn't eaten. All right, so my cravings are pretty high. All right, so if I get rid of all the food and water in this room and we tape everything off, and we just sit here and look at each other day after day after day, we're going to get hungry, we're going to get thirsty, and I promise you we're going to do a few things. Number one, we're going to drink each other's urine. It's going to happen, guarantee it. And after a while, we would start eyeballing each other to see who was the weakest. Why? Because that's the one that's getting ready to get eaten. Okay? Guys, that's how strong your will to live is. And the reason that I want you to know this is because this is the area of your brain that's hijacked by the drugs that we're talking about. The part of your brain that's responsible for your will to live, it's what's hijacked by the prescription opioids, by the heroin, by the alcohol, by the methamphetamine, whatever it is. So if you don't have it, you literally think you're going to die. So, good. I'm going to tell you my worst secret, the one I held on to the longest. I stole drugs from a dying cancer patient. Went into his house. He had metastatic lung cancer. He was actually just a few days from death. He was laying in his living room in a hospital bed. His little wife was cleaning him up. He'd lost bowel and bladder continence. And so she's, trying to keep him clean so he doesn't have to lay in his own feces. And while he's doing that, I'm in his bathroom, in his medicine cabinet, taking the OxyContin that I prescribed for him. It's my worst secret. And that one was really hard. And when I leave here in a little while, I'm going to be worn out because that one still absolutely wears me out. No excuse for it. What I told myself was that I can just rewrite it for him, so I'm not really stealing. It's not really going to hold up, is it? Right? He's stealing. And not only that, I'm stealing from a dying cancer patient. And here's the worst part. It wasn't just any cancer patient. It was my favorite professor from med school who came to see me as his doctor when I got out. He could have chosen anybody he wanted to. He came to see me. And I betrayed that trust, and I took medicine out of his cabinet for my own use. Why'd I do that? The reward system of my brain had been hijacked, and I thought that if I didn't have it, I would die, and if I'd had it, I would be okay. And I'm telling you, I would do the same thing. I see it all the time. That was the story that I was going to go to my grave with. I actually told that story, and it was on the front page of USA Today. And the reason I tell you that is that it's relief. Whenever you share something like that with other people who want to help you, I don't have to live with that. I can walk through it. And the thing I love most about it would be like if Sandra came to me and she's in denial about her drug use and I can't get through to her. I share that story because most people are most ashamed of the things they did to their own family or their loved ones. And when I do that, Sandra suddenly realizes that she's not alone in some of the stuff she done, and now we can start talking. So I don't regret it. I wouldn't take it back. I'd do it again. I'm not proud of it, but it certainly helped me in the care of my patients. Guys, the reason for that is that part of you. So when I see this, and I don't know if y'all have this here or not, but at home all the time we'll have people, child found wandering on the street, right? Or child found in squalor in trailer park. I never have to look any further because I know what parents are doing. They don't want to be bad parents, but they feel like if they don't have their drug, they'll die without it. And the reason is it hijacks the reward system of our brain. So that's the most important thing that you need to know. Now, I'm going to do a cutaway here. All right? So all we've done is cut me this way, longitudinally. I'm turning, looking that way. We're looking right into the middle of my brain. Everything under that yellow arch is basically our reward system, our go system. And everything up front is the frontal lobe. So I'm going to try to tell you how these two things interact. In the process, I'm going to teach you why your teenagers are stupid. All right. So the go system of our brain. The go system of our brain is responsible for our species going forward in time. What do we have to do in order to go forward in time? Number one, we've got to live to be reproductive age. Number two, we've got to have sex. If we do that over a large enough population, long enough period of time, our species will go forward in time. Okay? So the things that lead us to be reproductive age had better feel good or we won't keep doing them. Okay? So how do we live to be reproductive age? Food and water. When you eat and drink, does it make you feel good? Heck yeah. Right? It does. I can prove it to you. About 10 minutes after, you can barely hold your head up. Right? Because you want to go to sleep. Right? You're so relaxed, you want to go to sleep. So eating and drinking feel good. And the reason for that is whatever made us wanted it to feel good so that we would repeat the process and our species would go forward in time. If every time you ate or drank, you threw your toenails up, you'd stop eating and drinking. Enough people did that over a long enough period of time, our species would stop, right? So here's what happens. You're hungry, right? Your stomach starts to growl. We're talking about cravings now. They bring food in, cravings go up. You start to put a few bites in your mouth, and then the reward system of your brain, here's what happens. Your body makes its own heroin, its own fentanyl, its own oxycodone, its own hydrocodone. They're called endorphins and enkephalins. And those endorphins and enkephalins are released. They attach to the opioid receptors in this part of your brain, and it leads to the downstream release of something called dopamine. And everybody in this room loves dopamine. It makes you fat, happy, and satisfied. Okay? And then after a while, that dopamine is taken back up into the nerve ending, waiting on something else to come along and cause its release. You repeat that process. When you get hungry, you remember how good it was the last time you ate. You've got food available. You feed yourself. That process happens. You live to be reproductive age. Does sex feel good? Yes, it does. I say it even in church. Right? Sex feels good. If sex didn't feel good, nobody'd do it. I mean, it would. If every time you had sex, you got deathly ill. Now, guys, sometimes I wonder. But if you did, right? Our species would no longer go forward in time. So food, water, and sex, all good things, all in the go area of our brain. That's the reward system, right? Everybody agrees that food, water, and sex are good things. We're good with it? Can you think of an instance where food, water, and sex may not be a good thing? I'm going to give you an example. Anybody in the room ever tried to lose weight? Really hard to lose weight. So 2.5 years ago, I weighed 248. I had tried my entire adult life to lose weight. Struggled, I'm a workaholic, just didn't take care of myself. I put pregnancy hormone in my belly, HCG, for a whole month. I lost 50 pounds. Okay, I gained it all back in 2 months. So 2.5 years ago, here's what I came up with, and I want y'all to keep in mind, I'm a trained physician. I came up with this. I'm going to watch what I eat and exercise. Thank you. I'm going to write a book on that. Be short. This morning I weigh about 190. Okay? And I feel better than I've ever felt in my life, and I'm 51 years old. Okay? So in the morning when I work out, and hang with me here, I'm going to teach you why this is important, because we make decisions every day, all day long, based on these two areas of our brain. Every morning when I work out, what time do I have to? Make sure I get done.
You still have a few time.
No, what time am I done?
Oh, 10:20.
10, okay, I'm good. So every morning when I work out at this gym called Orange Theory, and I work out for an hour. Okay, and in an hour, I burn 800 calories, right? That's getting after it pretty good, 800 calories in an hour. When I come out of Orange Theory, right catty corner to the stoplight that I have to stop at is a Krispy Kreme donut. I'm going to tell you what, guys, I freaking love Krispy Kreme donuts. I told my wife when I'm on the vent ready to die, pull the vent out and stuff some Krispy Kreme out, because I want to go out with that. So what happens is I'm sitting at that red light and I look over and see Krispy Kreme. What's going on in the reward system of my brain? What's my brain telling me? Go get Krispy Kreme. I remember the last time I had them, I remember sugar dripping off of it, hot box, the whole deal, right? So the reward system of my brain is telling me to go do that. Now, I have a fully functioning frontal lobe of my brain. What's the frontal lobe of my brain do? Insight and judgment. So the frontal lobe of my brain says, okay, Steve, you can go have the Krispy Kreme donut, but here's the deal. You're trying to get in shape and lose weight. And each one of those Krispy Kreme donuts has 220 calories and 80 grams, or 20 grams of fat, each one. Now, that would be okay, except for I'm going to have 4. So 880 calories, 80 grams of fat. What just happened to my hour-long workout where I busted my butt? Gone. So guys, now I can make a decision to get to my goal because I have insight and judgment. Right? I can make a decision. Now, the people at Krispy Kreme, they know this. What do? First of all, they blow that donut smell out in the street. So I'm sitting there and I smell it. Right? All triggered to increase my cravings. Guys, the entire economic system, advertising system of the United States works on that. I went to the mall last night in Macau. Right? I ain't even hungry. I walked through the food court and the lady standing there with them little sticks that got Chinese food on it. I'm not even hungry. I'm going to the bathroom, and I always put the bathroom in the food court. So I walked through there and I went, oh, what the hell? I'll have it. Piece of chicken. Next thing I know, I'm in the line at the Chinese restaurant. It happens. That's how the system works. Now, I've overcome all this, right? My frontal lobe tells me insight and judgment. I'm getting in shape, losing weight. I've overcome the donut smell. Krispy Kreme has one last line of defense. What is it? The hot donuts now sign. Boom! Pop that thing on. Next thing I know, I'm talking to the lady to the microphone. Guys, that's how it works. We make decisions all day long based on rewards and our goals. Okay? And I promise you this is going to matter in substance abuse and your teenager here in a second. Now, here's the deal. The frontal lobe of our brain, insight and judgment, stop. And the go part of our brain, okay, pleasure are not neurologically connected until we're 23 years old if we're a woman and 25 years old if we're a man. I'm in women's prisons all the time, way more than I ever thought I'd be in my life. Right? I always teach women, please don't date any dude under 25. Right? You know, women, I know you can make this argument about all men. We'll slide that off to the side. Why? Because men under 25 are driven solely by this ego and don't have insight and judgment and not capable of being in a real relationship. Wait till they get a little older. My son's 24. He turns 25 in June. I can't wait to talk to him. I haven't talked to him since he's been about 13. Okay, guys, that's in normal development. Okay, so you're teenagers. Those of you who have teenagers. This is why they make bad decisions. They're not stupid at all. I want to say this as a joke. They're not stupid. They make bad decisions. They don't have insight and judgment. How did you feel the first time they drove down your driveway in a car by themselves? Pucker factor was like that. Right? The reason is you know that they could run off the road and hurt themselves or hurt somebody else. They don't have any clue because they don't have insight and judgment. You lay awake at night until you hear that door open because you know they're safe for another day. Guys, that's how it works. Now, when they get to be 23 and 25, they get mature, they have better insight and judgment, they make better decisions. Guys, that's how we're wired. So, Steve, that's all well and good. You're talking about my teenagers. What does that have to do with substance abuse? These connections between the frontal lobe of your brain and your reward system are arrested in development at time of first drug use. Think about that. How many times have you been sitting in front of somebody with substance use and you're trying to help them change a behavior and they're giving you answers like a 13-year-old and they're 35? And you're getting pissed. First of all, don't get mad. It doesn't help. If it helped, we'd have a clinic and we'd bring everybody in. We'd get mad at it. It doesn't help. So save yourself some grief. It'll hurt you. It won't help them. So anytime I feel myself doing that and they're making decisions like that, I stop myself. Sandra, how old were you when you first started using drugs? I was 13. Okay. I know how to deal with 13-year-olds. How long does it take before that frontal lobe comes back? And guys, if you don't remember anything else, please remember this slide. You can forget everything else I've told you. We only need this one slide for legislators to understand. I'm not going to say some of our other government officials to understand. If they understood this, they'd see what we're talking about. These are PET scans of brains. Don't get intimidated by PET scans. All PET scans do is look and see where sugar goes. Remember in high school biology class, every cell in your body works on sugar. Got to have sugar for energy. So if you had a way to attach a label to it, stick it in somebody, and that label could be seen by an x-ray machine, okay, then you would know what cells are alive and well. Okay? So this top row of brains right here are normal brains, right? Frontal lobe up top, reward system there in the middle, alive and well, right? See all the red and yellow uptake. All right, everybody got that? Look at the second row of brains. The second row of brains are brains that have been detoxed off of drugs for 10 days. Sandra comes to me, she's sticking needles in her arm, she has heroin use disorder. I bring her in, I detox her for 10 days. All right, Sandra, you're not dope sick anymore. I'll see you later. And I turn her loose with a brain that looks like that. What's not lit up at all? Frontal lobe. What's your frontal lobe responsible for? Insight and judgment. What is lit up? Her reward system. I just turned Sandra back loose into an environment with all of the cues for drug use, all the things to increase her cravings, no tools of how to handle any of them. And by the way, I took away all of her insight and judgment. What kind of chance do you think she's got? Has anybody ever seen a patient that went straight to detox and stayed clean and sober for 5 years? I've never seen it. I'm sure it's happened, but I've never seen it. It's the least effective thing we do, guys. Yet, it's what insurance companies pay the most for. They pay the most for the absolute least effective treatment that we have. And we got to stop doing it. Now, look at this bottom row, brains. What do you see in the frontal lobe? Starting to have a little insight and judgment, right? That's at 100 days, 3 months, right? You've heard it, those of you from AA parlance, come to 90 meetings in 90 days, right? How many times you heard it? It's actually true. They just didn't know why in 1935. Because at 90 days, you start to have insight and judgment. It starts to come back. How long does it take to get from right here to that top? Anybody know? Yes. 2 years. I had a judge one time tell me, Dr. Loyd, this woman is still on Suboxone, and she's been on it for 14 months. I'm like, thank God I was able to keep her in for 14 months. We only have to go a little further before she really starts to get some insight and judgment, and we can start cooking with gas. Guys, medication holds cravings at bay and gives the frontal lobe of the brain time to wake up so they can achieve behavioral change. It's as simple as that. If if you want to bend the curve in treating patients, give them longer treatment stays, utilize medication with support services and accountability aftercare for 5 years. I'm not talking about being in treatment for 5 years, but I'm talking about hold them in the treatment process for 5 years. 2 most successful groups in the United States by profession with regards to substance use disorder. What are they? Anybody know? Doctors and airline pilots. Why is that? People say, oh, they're smarter than everybody else. I'm a doctor, I promise you. Doctors are not smarter than anybody. Okay, I promise you. Neither are airline pilots. The reason for their success is they have 90 days of high quality treatment. By the time they walk out of the treatment center, they've already got some of this. They have 5 years of aftercare and follow-up with accountability, urine drug screens, and meeting with people. Yes, sir?
An opiate drug or just any drug?
Any drug. This one's opiates, but it holds true for methamphetamine as well.
Alcohol?
Alcohol as well. And I'll tell you this, the frontal lobe is even separated in process addictions like internet pornography. It's separated in gambling. It's all the same. You lose frontal lobe activity, you lose the insight and judgment. It's the same for all of them. Anybody else? All right. So doctors and airline pilots, 5 years of aftercare and follow-up. Do you know what their success rate is at 5 years for doctors and airline pilots? Clean and free of all things, no medication, nothing. 78 to 95%. Name me another disease that we have a 78 to 95% success rate with. Even Doc back there can't. We don't bat that with strep throat. Okay? But we don't get patients in treatment long enough and hold them accountable with all the services they need for 5 years. And you don't need 5 years of intensive services, but you do need regular follow-up. I'm 15 years out, and tonight, I'm going to miss it tonight. I see my therapist tonight. I see him once a week. And I do that for myself. It helps me. But I have the money to pay for it. Okay? Most people don't have that. If we want to give people true treatment that works over the long term, we need to make this commitment. Medication can help us get there. It helps level the playing fields. Anybody got any questions about that? Anybody that wants to tell me I've lost my mind? I probably have. All right, I'll wheel through the rest of this. It's pretty quick. When I have the first 7, I'm looking at the biology. I need to know family history, right? I need to know your personal history. Are you at risk? My second 7, the physiological or the psychological. Have you had any history of abuse? Guys, the ACEs study. Nobody raised their hand, and I'm freaked out by that. Okay, please, Google it. ACES, all capital letters. You absolutely have to understand ACEs if you're going to help people with addictive disease. Adverse Childhood Experiences study, it actually came out of weight loss clinics in California back in the early 1980s. Weight loss clinics where these women weighed 500 and 600 pounds. And the doctor's name was Vincent Felitti. And Felitti started looking at the women who relapsed after they got out. They lost all this weight. And then they would go back to eating right when they got out. And he was thinking, it was a common reason that they're doing this, because they would put the weight right back on. And so he came up with this list of questions he wanted to ask them around things in their life. And one of them was, how much did you weigh at the time of first sexual experience? And he figured out that he asked the wrong question there. Instead of how much did you weigh, he should have asked, how old were you? Because the answers he was getting when he asked how much the women weighed were things like 60 pounds, 75 pounds, 80 pounds. They were my little girl who was being physically and sexually abused in her own house by her dad. They had, instead of the weight, he should have asked the age, because they were 7, 8, 9, 10 years old. And so the food and the addiction was not the problem. The food and the addiction was actually the solution. And I would suggest to you guys today, it's the same thing with pills, heroin. It doesn't matter. It's not the problem. It's the solution to the problem. For me, the pills were a solution to my problem of feeling fulfilled from inside. Putting all these things on the wall didn't help. The pills did. It was a solution. For these young women, why would food be their solution? Because they'd eat, they'd put the weight back on, they'd become unattractive to daddy. And out of this was born the ACEs study. They came up with 10 categories of childhood trauma. Guys, you can